joining us today. We are here at 9 a.m. Central Time on December 13th, and I am going to be reviewing the Target and Probe and Educate program, otherwise known as TPE. So we'll be talking about what this program is and what the process is, and some key points related to that. So this is a review of the Targeted Probe and Educate program. It's not a new thing for Medicare, not a new thing that WPS is doing. And we did just want to provide some education for providers to gain, a good understanding, a basic framework of what goes along with TPE. This is a topic that we do see put into their comments of our surveys from past events as something people want a refresher on. So that is kind of what sparked the, planning for this event to give participants, a little bit of a refresher and answer some of your questions. All right, so my name is Rachel Wood. I am one of the nurse analysts with Provider Outreach. I am joined this morning by my fellow nurses in Provider Outreach, Mary, Sue, and Jennifer. They're going to be helping me with your chat questions as they come in. And if we don't have an answer to your question this morning, we will take those back to our medical review nurses and get an answer and follow up. If we can't follow up during the webinar, we will follow up via email. Regarding materials, those were made available to you on our live events page. So if you do need those materials still, those are out again on our live events page. If you find this event, you can click the link and it should take you out to those slides. All right, so here we have our disclaimer. This is pretty much just saying this education is for informational purposes only. Medicare does change their rules from time to time, so please make sure you're looking at the updated and official CMS communications for those most up-to-date rules and regulations. That does take precedence over anything that I present today if it does come out following the conclusion of our webinar. Additionally, as I said, I am recording this. We will post this on our YouTube channel as an encore if you want to take a look at this later. So please do not record this yourself for any profit-making purposes or in general, because again, we are recording it and we will post it for you to take a look at later. Here we have some acronyms that I'll use throughout the slides. Just use this as a reference. Some of the contractors that we have listed here, a little bit of alphabet soup. So if you have a question on anything that is in your slide deck, please take a look at this acronym page. All right, so that brings us to our agenda. So I'm going to start today by reviewing, as I said, what the TPE process is. We'll go over some of those basic information. We'll talk about additional documentation requests and some basics related to sending those in and receiving those, as well as responding to additional documentation requests, helpful resources, and then finally talk about some question and answers. We should have time to answer anything that you put into the chat. Additionally, we did get some pre-submitted questions prior to this presentation that I will answer. And we also did kind of trickle them into our slides that we'll go through. So that is our plan for our webinar this morning. All right, so I want to start by talking about giving a quick review about our medical review department. So at WPS, medical review, or otherwise referred to as MR, it is mainly made up of nurses that review Medicare claims sent in by providers to us. As listed on our slide here, the goal of medical review is to prevent improper payments and ultimately to protect the Medicare Trust Fund by educating providers on Medicare rules and regulations. So this is done by providing correct benefit coverage decisions on those reviews done by our nurses. You can find coverage guidelines in a variety of different places. I will talk about this in a future slide, but just as a couple highlights, coverage guidelines can be found in our local coverage determinations. Those are determined by us at WPS. You can also find them in national coverage determinations. So these are determined by Medicare and apply across, nationally. So medical review provides education to providers during the TPE reviews. And so that is where they come into play with the TPE process, and why I just wanted to start off by just defining who they are. So they're going to be the point person and the point of contact that you'll have in providing education to you during the review if you find yourself in one. So, and our main goal for their medical reviews, again, is to help identify and correct any billing issues, as well as work to reduce claim errors. So that is medical review pretty much in a nutshell. And now let's move into talking about TPE and, an overview of what this program is and what some of the goals are. Additionally, when might a provider find themselves in a TPE review? So this program is designed to help providers and suppliers reduce claim denials and appeals through one-on-one education, again, with that medical review department. So we're going to start by talking about the goals. And the first thing I want to mention here is that, TPE is not meant to be a punishment for providers. So please remember that. Sometimes we hear that from, people in their reviews, that they feel like they're being, it's not a punishment, and it's made to help, find what those pain points are, reduce your denials, and help overall long-term increase the efficiency, so you don't have to go through kind of backtracking with your claims of why was this denied, what do we need, what's this extra information that's missing that caused this discrepancy. So again, the idea is to help providers figure out where maybe they're missing a critical item in their documentation or in the processing of the claim. So maybe there is some type of confusion on how to bill, or your documentation may not fully reflect everything that you're doing with your patients. You do want to make sure that that information is fully reflected in the medical record. We know that providers do a ton, and sometimes it can be difficult to capture every single detail of those patient encounters into your notes. However, on the flip side of that, if it's not documented in the medical record, we as reviewers and the reviewers in our medical review department have no idea, no way of knowing that a certain clinical intervention was done, or certain assessment, and so on. So the goals of TPE are pretty similar to those goals of medical review. So first, to reduce appeals by correcting errors in the documentation, whether it's missing information, signatures, billing errors, so on. During TPE, we can identify those and then correct those mistakes. Ideally, when claims are approved for the services that are provided, that would be the result. We are looking for a approval of claims and not having claims and future claims being denied. And then our second goal would be to reduce provider burden, again, long term. So it's less work for providers if claims are sent in and processed cleanly the first time around. So reduce time working with appeals, sending in additional information, figuring out what's missing, and kind of doing some of that backtrack work. And then finally, improve the medical review and the education process. So this one does correlate with those other goals. Reducing errors in the claims speeds up the medical review process, and then we can focus on educating providers on those new and developing Medicare coverage guidelines, because as we know, Medicare does update the guidelines and the coverage information from yearly, and sometimes more often than that. All right, so let's talk about the process. We've covered who medical review is, what the goals of TPE are. So now let's talk about the process and how TPE works. On our slide here, we have a graphic that Medicare does provide on their website. And this graphic illustrates the steps of the TPE process if you were to find yourself in a review. If chosen for the program, providers will receive a letter from WPS And that letter explains that you've been selected for a TPE review and what types of claims we're going to be looking at. WPS will then look at and review between 20 to 40 claims for the specific topic in question. So at this stage, we may request additional medical records to support the service that was provided, and that service, and support the rationale of why that service was medically necessary for that patient based on the Medicare guidelines. And so next step, if all the claim review looks good, you'll see we move into that green arrow, that green check saying compliant. So if that is the case, you'll be in the clear for this topic for at least a year. Now, if we do find any errors, any claims were denied, missing information, and so on, that'll send us down to that red X, and this is where we'll hold some one-on-one education to go over what those denial reasons were, how to correct whatever we found, during our reviews, and at that time, you'll have 45 days to make any necessary changes and corrections. After that 45-day period, we will start this cycle over again and look at between 20 to 40 more claims. So that, in a summary, is the TPE process. And again, this is on the Medicare website if you would like to refer back to this chart. So I want to talk a little bit about some common claim errors and errors that our nurses see a lot during their reviews. And these are not new items. So if you've attended any of our education related to our monthly medical review issues and errors, typically these things come up in almost all of those sessions in various ways they pop up based off the service and coverage guidelines in question, but they're pretty much the big repeat offenders. So first would be missing the physician's signature. Or missing signature in general. So this is straightforward, but it is a very common reason that claims are denied and a pretty simple thing to remedy. So make sure that those notes are signed when submitting documentation to support the claim. Next is meeting coverage criteria. So this information will vary depending on the service in question. Does Medicare cover that service in the setting it was provided? And the final piece we have here, meeting medically necessary guidelines for the service provided. So even if the service that you're providing to your patient is a covered Medicare benefit, Medicare, service item, so on, the care that you provide still needs to be clinically appropriate and medically necessary for the person it was provided to on that date of service. So, in a sense, that coverage criteria and medical necessity piece go hand in hand. So again, just because something is covered, it does still need to be reflected in the notes that it's clinically appropriate for the patient it is provided to. Hopefully that makes sense. All right, so I kind of alluded to this in one of our first prior slides, but on this slide here, we do have listed some of the different places you might look to find the coverage requirements for the service that's undergoing TPE. So we will also, in addition to these, typically create an article on our website. We did list on our slide here the WPS-GHA website, but typically each TPE service that we are reviewing will have a separate article, and we are going to include in that article steps to a successful TPE review, so some of the documentation items that we're looking for that specific service. And then also within those articles, some key resources to look at and check on, we'll kind of condense them into our articles that we post for each service. So in addition, and this will also be in your articles typically on the WPS website, but you can also find information service dependent for coverage guidelines in our local coverage determinations. So for those that might not be aware, these are determined by MACs, so they're determined at that local level. Referred to as LCDs, they will also have sometimes an LCA, so that's going to be the article that talks about billing information. And these will provide specific coverage requirements and billing guidelines, again, that might vary MAC by MAC. So the next item that we have listed here is our national coverage determinations. I talked a little bit about this already. So this is what it sounds like. They are coverage requirements that are determined at the national level, otherwise referred to as NCDs. And these will apply to all MACs throughout the country. So an example of a service that follows an NCD that we're currently reviewing is lipid panel testing. So that is where you'd find the coverage guidelines for, what we're basing our reviews on. Well, one of the areas. You can also look in the next one on our slide, the internet-only manual. Regarding lipid panels, I will be hosting 2 webinars talking about that topic next week. So please sign up if you want to know a little bit more information and look into some of our reviews on lipid panels, and we'll take a look at that NCD and all of that fun, interesting information relating to that TPE topic. So then finally, we have listed here internet-only manuals. I will say that these are an excellent place to look. They can be a little bit more time-consuming to comb through if you're looking for a specific coverage, because they do contain so much information. But typically we do have on our WPS articles, we will include some of the sections that are relevant for the IOM. Again, those will be included on our website, and hopefully would cut down a little bit of searching time for the providers. One thing with the internet-only manuals is that I do want to just point out that MACs are able to make, there are some coverage and wording and buried somewhere in the IOM that does say that MACs are able to make coverage guidelines and determinations on their reviews when sections of the IOM are silent. So I do just want to mention that, because sometimes we get questions from providers that say they can't find a specific line that reflects what we're asking from them in the IOM. They can't find that specific wording. And so, that would most likely be why, if the coverage guidelines are silent, we do have some leeway to make, some decisions on, independently as a MAC. I don't have an example scenario for this, but just be something, mindful that that could be something that you might run into. All right, so we've had a lot of questions on relating to TPE from attendees. We've had a lot of questions from those that signed up for this event to talk a little bit about the additional documentation requests. So I do want to review some information on this. And I'll first start with what additional documentation requests, or ADRs, are. So if WPS selects a claim for review, we will send a ADR letter to you and your facility. And this letter will include what additional documentation pieces that we're looking for. So what else do we need for a complete set of notes for the service in question? What should that look like? What should that include? And then finally, those ADRs at the top of those letters typically will include any relevant resources that we are looking at to support the information we're asking for in our ADR request. So again, these requests are generated when documentation is necessary to support that Medicare claim sent in. And the request for these will be medical record documentation to support that payment of the item or service in question. The ADR is sent to a provider's practice address that is on file with Medicare. So we get this question from time to time: where is it going to be sent to me? You can view these in the portal, but they also are sent to the address, again, on file with Medicare. So please ensure that, to make sure you're receiving that correct ADR ADR letter to the correct address, be sure that the information in your medical review correspondence address in the PICO, so that's provider enrollment chain and ownership system, is correct. And we do, I believe, have a YouTube video. If anyone is interested, you can, message us or look on our website. But I believe do have a video that gives step-by-step instructions on how to update that address on our YouTube channel. So if you are looking for more information on that, I believe that video is posted in, I want to say, the documentation section, but if you look up medical review correspondence, it should pop up. So the additional information for ADR requests should be submitted in the time frame that is specified on that letter. For MACs and for WPS, providers should send in documentation within 45 days of receiving that ADR letter. So if we don't receive this timely, if it's past that 45-day mark and there's not a follow-up from the provider, we hear radio silence, we will process the claim, and typically that will result in a claim denial. And so one other thing that we have on our slide here with these ADR letters is that they can come from other contractors. So you might get one of these from WPS that is sent specifically during our TPE review. You might also receive an ADR from another contractor that we have listed here. So CERT could be an example. We have these contractors, what they stand for, listed on our acronym slide, but you can, again, receive these letters from other contractors beyond MACs. All right, so let's talk about responding to the ADR letter. So the medical review calculator is available on our website and is able to assist providers in determining what that final date of documentation is that they must send their notes back to us and respond to those ADR letters. So you have a couple options to respond. You can respond the same way that you received the letter. So if you got it via mail, you can respond via mail. We have the specific website or specific mailing address on our website, which we've embedded a link to that on our slide here. Make sure you check the jurisdiction that is selected, and then that should provide you accurate information. You can also send that in using your portal account if you have that. You can respond using, again, the portal. And you may also send it in via fax. So those fax numbers, again, same link would be used to go to our website. Again, check that jurisdiction because it might vary depending on if you're J5 or J8 and then Part A or Part B. All right, so when preparing to send your documentation back to us, it's a good idea, it's a good best practice to attach a copy of the letter that you received as the first page to ensure that the documentation is matched to the appropriate patient as well as the claim. Providers should submit the necessary information that supports the service for the billing period that is being reviewed. So again, we want to know information about that specific date of service for that specific claim. We don't really need information unless it applies for future visits or prior visits. We would just need to know about that specific clinical situation that the claim is for. Regarding the 45-day calendar period, we will again accept documentation up to that date. However, Medicare does give a provision that we can receive it after if there's quote good cause. And what Medicare means by that is that for situations such as natural disasters, interruptions in business practices, or other extenuating circumstances that might occur, good cause would be a reason that the provider could send in their notes late. You would just need to communicate that to us at WPS. And again, just keep in mind that if you do not send in your information in a timely manner, you don't respond with any kind of feedback to us, most likely the result will be a denial for your claim. And if we're in the TPE review process, you'll have to go on that cycle again and again. So please keep that in mind when you receive these letters. All right, so we're getting close to the final slides here. Before we get to our question section and I talk about some of those pre-submitted questions, I want to just talk briefly about some documentation tips for a successful TPE review. And these tips will apply to all services across the board. There will be some more specific things that we look for, obviously, service by service based on the coverage guidelines, but these are the big ones and go hand in hand with those errors I talked about previously. So first on our list, the documentation must be complete and legible. Again, please include all of the coverage requirements to support the medical necessity of the service in question. Typically these days, notes are typed using electronic health records, so legibility is not as big of an issue, but if your facility does use any handwritten documentation pieces, so maybe you're completing a pain scale or disability scale that's done by hand and then you scan it in, please make sure that the information, if it's not documented anywhere else, is legible and a reviewer would be able to interpret the document with the handwriting. So we'll also be looking for the date and signature of the provider. This also needs to be legible, and typically this will be the provider that is supervising and providing the service. So it could be the ordering provider signature that we're looking for, but we do want to see, again, that signature and the date. And then I mentioned this, but the documentation should support in the medical record the service that is being billed for. Sounds obvious, but I do mention it because sometimes at the time we receive information in the medical record that, maybe it's for a different service than what is being billed. Or we see it, documentation sent in for a similar service, but the provider facility billed either maybe too much or the wrong CPT codes when maybe the codes are close. So those are some things that are easy things, easy errors and things to look out for. All right, and then the final items on our slide repeat what I've mentioned. So again, just make sure your entries are legible, complete with all of the medical necessity pieces. They include the date of the service, the time, if time is something that is applicable to the service in question, and are signed by that provider. All right, so in this section, I do want to, before I open it up for questions in the chat and just peeking at it, I'm not seeing a ton in the chat, so if you do think of any questions, please submit those in to us. But I did want to just talk about some of the pre-submitted questions that we got and some of the comments we got prior to our event today. We did have a few providers that wanted to learn just more about the TPE program in general, about what ADRs are and how to respond to those, and then some areas to look for coverage criteria as well as relevant resources. So that is information that we've covered so far. And we did get a couple repeating questions that I am going to go through, kind of summarize them, but they were repeating from pretty much all the other items that we got submitted prior to today. So our first question that we received, how are providers selected for TPE? So the answer to this question is that our Insight program, which is our data analysis program, identifies providers through a couple different avenues that look for, those providers with high denial rates, so those that pose the greatest financial risk to Medicare. And we're looking at the high denial rate. So it's looked at by a national level. So, Medicare in general might want us to be looking at something, but typically we get them at a more internal level through the MACs using our data analysis team. that is how you might be selected for a TPE review. Again, you're having high error rates and high denial rates for the service in question. All right, so our next question is, how will a provider know if they've been selected for a TPE review? And this will happen through our medical review nurses reaching out to providers and letting, we'll let you know that you've been selected for the review, what the service is, and what information we need back from you. So you should get a notification from WPS, and then that should give you some help for the next steps, as well as the nurse that you're working with should be able to answer some of your questions on, maybe what specific items we need and so on. All right, so next question that we got in that was kind of across the board is, and I did answer this already, but just to review, to what address will my ADR letters and my medical review correspondence be sent to? So again, this is going to be in your PICOs or provider enrollment, the address that is listed on file for that. So please make sure that your provider correspondence address in provider enrollment is up to date, because that is where that information is gonna go. And I know that sometimes when we've looked into these things in the past, they are not up to date, and providers are not getting the most recent information that they do need. All right, so next question that we got in was, a provider is moved to an additional round of TPE during the review process. When should that person expect additional reviews to start? So for this question, I would refer you back to the process chart that we talked about. But the answer to that would be 45-day period providers will have to make those changes before they cycle into that next round. So that's when that new review period is going to start, when you have to do an additional round of TPE. All right, and then finally, our final question that I want to mention that was pre-submitted is, can a provider be included in multiple TPE probes or inquiries at the same time? So this is something that could occur. In one instance, maybe the provider has multiple NPIs, and each one the facility could have multiple NPIs working under them, and each one could be subject to that TPE review. You could also have a facility that, maybe submits for multiple types of services that are being reviewed in the TPE process. So, and those services have a high error rate. That situation could occur. Not super common do those overlapping scenarios happen. What I mean by that is, say a provider that's performing sleep studies, which is something we are looking at for J5 Part B, likely doesn't also perform pain injections. So that is another item that's listed on our TPE topics at their facility. So some of those more specialized services, you're not necessarily going to see overlap. You could. So that's why we would answer yes, you could, but typically a sleep specialist isn't also a pain specialist. But you never know. So that is a summary of our pre-submitted questions. Here we just have a few resources to take a look at if you would like to, follow up with anything on that I've gone through. And, so just some links out to Medicare information, some question and answers, and then additional ways to reduce documentation burden. So kind of streamlining that documentation process. And with that, I want to pause and take a peek if there's any questions that have come in that we want to answer for the group. Not seeing any.
Questions. chat.
Okay. All right. Well, if you think of anything, I'm going to have a few more slides that I'll go through, and please send those to us. Okay, so that sums it up for our webinar today. I want to thank you all for joining us, and on behalf of myself, Mary Sue and Jennifer, and the rest of Medical Review and Provider Outreach, thank you for participating in our event. So again, we look forward to those survey comments and any feedback you can give us and your attendance of our future events. And you may now disconnect.